Just the simple things I couldn't even do, and it just robs you of life that you've always known.
I was in pain all the time, and I never knew. I couldn't walk 6 blocks. I couldn't walk from a restaurant downtown home.
He was in so much pain. It was a big part of our conversation almost every day.
When we would go to a party, the first thing I would do is look for a chair.
Hi, I'm Vanessa Hill. Welcome to another edition of The Age of Spinal Medicine. As you may know, the Southeastern Spine Institute has produced this series of medical shows to help educate the community on today's advancements in spine medicine and to let people, maybe like you, know that they no longer need to suffer in pain.
I was grimacing. I didn't realize I had a frown, you know, because I was kind of anticipating the pain I had before, and it wasn't there.
I think I probably would have been in a wheelchair for good if they hadn't done that.
I woke up out of pain. I could tell instantly that I was not hurting anymore.
Everybody's going, oh, how are you doing? I mean, you just had surgery, and I'm like, I am great. And I haven't been able to say that for so long.
The Southeastern Spine Institute has helped thousands of people suffering in pain get back to a full life again. But our goal is to not just say we can help you, but to actually do it. The Southeastern Spine Institute wants you to know that we are here for you throughout your lifetime, no matter your age or your problem.
I felt like back pain was for old people. I always heard my dad complain that his back hurt, but I didn't think that could happen to me.
I may be 8 or 9 years old, but I expect to have some more good years. And I don't want to hurt.
In this edition of The Age of Spinal Medicine, we will be meeting real people from all walks of life in almost every age.
They helped me out tremendously. The physical therapy that I received was amazing.
It's opened up life like it had been before 6 or 8 years ago.
I feel great.
Always one step ahead, the Southeastern Spine Institute presents another edition of The Age of Spinal Medicine. This episode, Spine Care for a Lifetime. Once again, your host, Vanessa Hill.
Welcome back. Do you know that here at the Southeastern Spine Institute, we have doctors and medical staff who understand military vets?
I retired as a colonel, and I've sort of seen every aspect. I went in the military as an E1 and left as an 06.
These brave men and women who served our country deserve the best medical treatment available, and they find it right here at the Southeastern Spine Institute.
They are used to being very active, so what happens is over time they can have spine issues, and what we want to do is keep them active.
I think when somebody has a spinal problem, they tend to seek out a specialist, and when you have a complicated spine problem, well, we're happy to see our veterans, especially if they've got a problem like Colonel Radcliffe's.
You know, this thing is a lot more serious, and I wanted to pick the best I could.
We will hear more on one Marine's story and discover how, although he was accustomed to toughing it out when it came to his back pain, well, he needed help. But first, some of you may remember pro golfer Ricky Sullivan from an earlier show. Well, as promised, we're going to take a closer look at his remarkable success story. And as you will see, sometimes when it comes to back pain, well, the whole family can be affected.
He was always like, ugh, I'm going to bed, it hurts. And he wouldn't help.
His whole demeanor changed. And, like my kids said, he just was cranky.
In this family story, we'll see that wife and mother Shannon would also need assistance for her daily back issues. But as for Ricky, neck pain made his professional life as a golf instructor very hard for everyone.
Spend a lot of time having to be in a good mood, because I take care of the public. Just couldn't do that when you're in so much pain and not knowing it. So I love what I do, and it was affecting what I do.
So I had no rhythm or tempo or timing into my golf swing, but actually didn't know why. It's kind of like your sight. When your sight goes away, it's so gradual you don't know it.
I really felt like, wow, here I am, this basketball player, golfer, baseball player, did all these things my whole life, and the gym, and I couldn't do them. I couldn't do any of them. I've fallen into a depression, and my wife would say that as well.
And he literally would go to work, come home, and he didn't want to do anything. He didn't want to talk. He wanted to close all the blinds. He wanted to lay down. and he just didn't communicate.
I was completely miserable, and there's no way that it couldn't affect my kids. There's no way that it couldn't affect my students.
Ricky finally realized he had to do something, if not for himself, then for his clients and his family. But it isn't always easy for athletes to admit defeat and ask for the help of a doctor.
Athletes are probably the worst to go, hey, I need to go seek out a doctor, something's wrong with me, just try to tough it out. I think I toughed it out for 3 or 4 years.
Finally, Ricky chose to see Don Johnson of the Southeastern Spine Institute, who quickly got to the core of Ricky's problem.
Don Johnson at Southeastern Spine Institute took an MRI and saw that I had a herniated disc. Started taking some prednisone, that helped, and we took some injections, that helped. And then it just progressively got worse, and he managed it for 3 or 4 years, and then it got so bad that I just wasn't myself anymore.
Ricky wanted to avoid surgery, and Ricky went through non-operative treatment that helped him for a number of years. Gotten much worse. We now have a large herniation right here. What that means is that the disc has slipped back and it's pressing against the spinal cord. Your spinal cord is going to get injured permanently if we don't have some kind of surgery at this point.
He was telling me, put it off until you can't put it off anymore.
Most of the doctors at the Southeastern Spine Institute are not surgeons. We're a large multidisciplinary spinal practice. Even the surgeon's goals are to get patients better without surgery.
That's our goal here, is to obviously to prevent patients from requiring any type of surgical intervention, and the faster that we see the patients and get that diagnosis and get treatment started, the better chances that we have of avoiding anything more invasive such as surgery.
I think that they have a great philosophy of trying to do non-surgical options first, because those work for so many people, and if you can avoid surgery, you should at all costs. However, when you do need it, you want to go to the best.
Well over 90% of our patients follow a non-operative approach, and our team of physicians work together to find the best treatment for your specific back or neck pain. But we also understand the fear that goes along with having a problem with your spine.
When somebody comes in and has a spine problem, it can be a little bit scary. You come in, you don't know what your diagnosis is.
I was in such a great amount of pain that just being around people I didn't know was scary. But I have to say, immediately walking in, they just took me in with open arms. They immediately made me feel so comfortable.
The slogan, "One Step Ahead," is truly what we do here. So we're really always looking for ways to improve our service.
You know, a lot of times it's hard to find that these days. I mean, people that work at doctor's office, I think sometimes become numb to really what you're feeling and what you're experiencing, because that's their job.
And so there is that need to make a patient feel comfortable, that we all communicate with each other and understand the treatment plan for a patient.
We're fortunate here to have multiple physicians who specialize in spine care, from surgical to non-surgical modalities. We communicate with each other and work with each other and discuss individual patients to come up with the best plan of treatment for them.
But it is nice having everything here: physical therapy, MRI, the ability to do any kind of x-ray that we needed to do for the patient. We also have a lab and a small pharmacy.
So more often than not, we're able to get patients back to their active lifestyles, back to work without going further.
If someone has surgery, we feel that they must exhaust all non-operative treatment first.
The vast majority of patients find long-lasting results from the many types of non-operative care found at Southeastern Spine. However, sometimes a structural spine problem just can't be corrected with these treatments alone. But if an operation is needed, rest assured that spine surgery, like so many of our new medical technologies, has come a long way in a short time.
Went home the same day, went back to work 4 days later. And I could have went back to work the next day, but he would have not been happy with me.
He's gotten an excellent result. He's got full strength back and has returned to all his activities, including his love of golf.
I send everybody I can to him.
And one of Ricky's referrals turned out to be all in the family. When we come back, you'll hear how Ricky's wife, Shannon, was having her own back issue.
When I got home from work, I didn't want to be with the kids. I didn't want to be with Ricky. I wanted to lay down, go in a dark room, and kind of wish the pain away.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. And you can watch any of our Age of Spinal Medicine shows by going to southeasternspine.com and clicking Medical Documentaries. Once again, your host, Vanessa Hill.
Welcome back. Now, while Shannon was watching her husband overcome his debilitating neck problem, she was in great pain. And although she knew she had to be there for her family, sometimes the pain was just too much.
After the birth of my son, Dr. Johnson had told me that I had had a herniated disc. And we were able to control the pain with the shots. And it was great. And I would get right back to it.
Ricky's wife came to see me after his problem. She had a low back problem. She's got young kids, a busy life.
As a mom, you just don't realize, I pick things up, I turn. I didn't realize for the longest time that I was doing it all wrong. I never stopped to think, boy, I should use my legs a little bit more. You just do, and you don't really think about it.
A lot of people don't think about their back and how they move and do things. So another way Southeastern Spine helps people maintain their lifestyle is by teaching some simple changes.
For example, instead of sitting for hours on end working, you may want to take a break every half hour, and get up and stretch and move around.
We talk to them about what they want to meet in their personal life, and we work with them through activities of daily living, especially working on body mechanics, personalized exercises. Do they want to go back to Pilates? Do they want to go back to running? Are they a golfer? And we take that all into consideration.
This past year, I started having a little bit of a different pain. It was kind of going down my leg, my sciatic. And I just remember telling my husband, I'm like, there's just no way I can do this. I cannot live with this pain.
Once it gets to a certain point, there's only one thing that's going to help.
Shannon also had an outpatient surgery, and she's done excellently from it.
But she was a different person after she just instantly came out of surgery, so you could tell that she was relieved.
She's back to all her activities, and they're back to a nice family life together.
I watched how they single-handedly gave us back our family life.
Okay.
Blue, orange, or red?
Orange for the Tigers.
It's back to normal. We're playing with the kids. We're kind of getting our life back, and it's great. It's kind of going back to our norm.
Good to have you back.
Thanks, man. Good to be back.
When we come back, you might just relate to our next story, how an active military man faces having less freedom and how it feels to deal with debilitating back pain.
It was like I was just set adrift, because I had been used to either being towed or pushing or rowing or something, and now I couldn't do anything.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment.
Welcome back. I am sure that you all know someone who has a career in the military. You yourself might have served. So, as you know, these individuals are always working hard, staying fit, and expecting a lot of themselves and their bodies.
They kind of get themselves in the zone, and nothing's going to bother them. And because they're 30 or 40 or 45, and they just keep on going, just keep on going. And I thought even after I retired and stuff, I was going to be able to do that.
But as a soldier gets older, it gets a little more difficult to maintain a strict regimen.
Military personnel who have come in here over the years, even after they've retired, and they say, gosh, you know what I really want to do is get out and play some golf now and do some activities. And we can certainly keep them doing that with some of the options that we have.
Earlier in my life, I could do things and overcome it. I was in Vietnam, I got hit 3 times, I didn't lose an ounce of blood. So I just figured out, what's wrong?
So when back or neck pain sets in, just like the athlete, the soldier often feels they can work through it or just grin and bear it. But for Colonel Mac Radcliffe, it was hard to slow down. He was accustomed to being on the go. It was his life.
And when the back problem came along, not only did it curtail my, like lifting weights and things like that, or try to do pull-ups, it hurt. It hurt.
He would try to cover it up as much as he could, but then there came a point where he really couldn't cover it up because he was in just so much pain.
The problem with grinning and bearing it is that sometimes if you grin and bear it through compression against the nerves, you can actually cause yourself permanent nerve damage. And you were having pretty bad pain down your thigh.
I couldn't move.
Right.
A lot of times I couldn't.
Right. His thigh muscle was so weak that when he tried to stand up, when he tried to walk downstairs, his legs would buckle.
And he would go down the steps, and all of a sudden I'd say, Mac, where are you? And he'd fallen.
Now, being a Marine veteran, he sucked it up and tried to deal with it until the pain and the weakness was so profound that he was essentially unable to get up and walk even 100 feet.
I couldn't walk from a restaurant downtown home. A couple times my wife had to just leave me there and she'd go home and get the car.
As you know, sometimes a pinched nerve can not only cause back or arm pain, if untreated, it might lead to permanent nerve damage.
I had an old expression, you know, that I'd rather wear out than rust out.
One of our doctors knows firsthand about the military attitude.
I can relate to them, absolutely. I mean, I spent 25 years in the military. I've been mobilized to Iraq.
Another physician at the Institute, Dr. Stephen Paletti, and his team worked out a program to get Mac back to his active life.
What we wanted to do was to have him go through physical therapy to maximize his ability to recover.
The leg got stronger, but the pain didn't go away, and it wasn't going to get any better without the operation. I can't spend, you know, the next 6 months like I spent the last 6 months. It's just ridiculous. So my aversion to, you know, being operated on subsided a bit.
Years ago, this kind of operation would have taken hours. It would have kept him in the hospital for days, if not weeks, and he would have never recovered like we wanted him to.
So it's amazing the technology that goes into these procedures. Even since we've been doing it, we've evolved.
But for you, and part of this is because you're in good shape and pretty motivated, we were able to do that smaller incision through the side to remove and replace the disc. And that nerve was under so much pressure, that's why your leg wasn't working right. He had to build that strength back up. Luckily, he's the kind of man that will put the work in, and he got over it.
As great a job as you did, and you did a great job. Your physical rehab group is super, and they're professional. They don't give you any slack.
Okay, keep that knee straight.
Okay.
It's very important for the patient to be proactive. The more motivated the patient is, the harder we can work to progress them.
So Mac was able to get back to his active life and even enjoy the long walks with his wife again. But he was lucky to have caught his nerve damage in time.
And so in a case like Colonel Radcliffe's, we luckily got to it so that that nerve damage was reversible. That's not always the case, though.
Certainly, if you're in a situation where you're having weakness, there should be no delay. That needs to be addressed right away. You should be evaluated as quickly as possible.
I'd tell them not to wait until something goes wrong. If they're starting to feel that the back is bothering them, they need to go have it checked out.
This Spine Institute is very specialized. We have a lot of options, a lot of opportunities, and this is what we do every day.
Our soldier's story ends with Mac not only feeling a lot better, but also glad he found a first-class unit at the Southeastern Spine Institute.
And it was orderly, it was well run, people know what they were doing, and they were polite to you. I'm up and moving around. And,
right, you know, right, you look good.
Thank you.
Yeah.
Thank you. A lot better than I did the last time you saw me.
Right, I hope I stay looking that good.
It's opened up life like it had been before, 6 or 8 years ago, except I'm 6 or 8 years older.
When we come back, you'll hear the story of one of our more mature patients, someone who believes that even as you're getting older, there's really no reason to live in pain.
I may be 8 or 9 years old, but I expect to have some more good years. And I don't want to hurt.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. And you can watch any of our Age of Spinal Medicine shows by going to southeasternspine.com and clicking Medical Documentaries.
Welcome back. You know, people come from all over the country to the state's largest spine-only practice and South Carolina's only ambulatory surgery center dedicated specifically for the spine.
When I go into something like this, I look into everything that I can find out about who I'm going to and what's going to be done.
I decided that I was going to have to take care and embrace my own medical care.
We know there are many places promoting their treatments for back or neck pain, but before you travel too far, you owe it to yourself to get the proper diagnosis and check out the many treatment options that are available right here in Charleston.
I heard a person went to that institute in Florida, and it was a terrible experience. So I said, why should I go to Florida or someplace like that when I can go right over here?
And so between the internet and reading and talking to other people, I felt that I really found the very best care that I could that suited me.
Our practice is not a local practice. Over 60% of our patients travel over 150 miles to see us.
He said, now when you get home, Google me on the internet and the operation. And he turned and looked at me and I said, Dr. Johnson, you don't think I've already Googled you?
But often in the end, people searching for answers find the best solutions for their specific spine problems right here at the Southeastern Spine Institute.
I started my search at Southeastern Spine, went full circle all the way around 180 degrees and ended up right back at Southeastern Spine.
If they want the best back doctor in the world, they need to come to Southeastern Spine.
Southeastern Spine has been selected to perform a number of national medical research studies and is one of the first practices in the country to do artificial disc replacement as well as routine outpatient surgeries. Here, we can diagnose and treat almost any type of spine problem, and often in the very same day.
All of the resources that we have quality diagnostic facilities that can pick up and diagnose abnormalities that have been missed and not picked up by other MRI machines. For our patients who come from Charlotte or North Carolina or Atlanta, it's an immense advantage and convenience to them to get an opinion and to get an answer to their long-sought problems all on the same day.
I had an annular tear as well as a herniated disc in the lower lumbar region.
Now you might be asking yourself, April looks so young to be having such a problem. And you'd be even more surprised to find out what she does for a living.
With being a personal trainer and understanding how important it is to have such a strong foundation with your core muscles and your back all together, I was surprised that I encountered this injury.
When it comes to young people having back issues, Allison was also concerned that she shouldn't be feeling old, not like her dad.
But I felt like back pain was for old people. I always heard my dad complain that his back hurt, but I didn't think that could happen to me.
We'll see later how these two young women found that the expertise offered at the Southeastern Spine Institute would help them get their active lives back and maintain their youth. But first, let's meet one of Southeastern Spine's oldest patients. Now, before she came to the Institute, Madge was having two problems: the pain in her back and finding someone who could help.
The longer the time went on, the worse I hurt. I got to the point where I could hardly walk. I kept going to different doctors trying to find somebody who would help me. Most of them said, I can't help you. One said, I can help you, there's an operation I can do, but I won't do it because of your age.
The Southeastern Spine Institute has been helping people of all walks of life for over 20 years. Here they feel that no one should have to suffer with back or neck pain, no matter what their age.
So when Dr. Johnson sat there and looked at me and said, yes, there's an operation I will do on you, and it would help you, I'm sure it'll help you. And he paused, and I said, you aren't going to say, but you won't do it because of my age? He said, you're young and healthy. That's all I care about. I said, find you a doctor with sense.
Well, we tell people that it's more about the quality of life than it is about the length of their life. So quality is very important.
As far as Dr. Johnson's operation, I came back, no more pain.
She come out the hospital and I never saw nobody recover as fast as she did.
I may be 89 years old, but I expect to have some more good years.
Now that Madge is free of back pain, you won't be surprised by her answer when asked how old she feels.
How old I think? Nowhere near 89. Nowhere near 80. In fact, I look in the mirror and I say, who are you?
At the Southeastern Spine Institute, we're always here for you no matter what your age or when you start to experience back or neck pain. We like to think of it as offering spine care for a lifetime. Part of that care is not just helping you when you've sustained an injury, but being here when you first start feeling pain. It's important to come in as soon as you can so that we can examine you and get an accurate diagnosis.
The earlier that we get that patient in to start treatment, the better chance we have of keeping them from needing to come back.
Once we have a clear picture of your exact problem, we are then able to help you get out of pain and often stay pain-free with non-surgical objectives like core strengthening exercises or simple lifestyle changes.
He took a look at my MRIs and just was extremely informative in showing me where my pain was and then going over options of how to deal with my pain.
I educate the patient on what their diagnosis is, because if they can understand what is wrong with their back, then they can make right decisions later in life when I'm not there to direct them.
Along with physical therapy, one of the things that was stressed through the different sessions was making lifestyle changes to accommodate the needs of my back. And I think that was a really important change in my life, to not be so stationary for long periods of time.
A lot of people today are focused on working on a computer, doing a lot of typing, and oftentimes they have their head in a flexed position. Certainly there are ergonomic changes which can be made through your workplace where your head is in a more neutral position, which puts less strain on your joints.
I feel great. I had my last treatment in March, and since then I have not felt the need, other than doing my daily stretches as prescribed, to seek further treatment.
They helped me out tremendously. The physical therapy that I received was amazing. It seemed to really help. And along with that and Dr. Paletti's care and doing my own exercises, I was able to shape back up.
Southeastern Spine wants you to know that we're here for you anytime throughout your life, no matter your age or your problem. It is our way of giving you spine care for a lifetime. We hope you've enjoyed the show and learned a little more about spine health and spine care. Remember, our stories are about actual patients getting back to enjoying life again. You don't have to suffer with back or neck pain. Come see if the Southeastern Spine Institute can help you too, and maybe you'll be happy to tell your story on camera during our next edition of The Age of Spinal Medicine.
Done, and without the treatment and the service that I've gotten from Southeastern Spine, I believe 100% I wouldn't be able to continue to do what I've been doing.
I would recommend Southeastern Spine to a friend, a stranger, to anybody. I mean, they have really done wonders for me.
Yeah, life is great. Every day you wake up is a good day, and every day you wake up with no pain is a great day.
I really feel it's the best place. I have always felt that I'm so fortunate to have this place in my own backyard.
I've been able to dance with my wife, dance with my daughter who got married last weekend.
Very glad to have found Southeastern Spine Institute because it has changed my life.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. And you can watch any of our Age of Spinal Medicine shows by going to southeasternspine.com and clicking Medical Documentaries.